Classification of joints. A joint is defined as a connection between two bones in a skeletal system. Joints can be classified by the type of the tissue present, fibrous, cartilaginous, or synovial, or by the degree of movement permitted, such as synarthrosis, amphiarthrosis, or diarthrosis. In these slides, we shall look at the classification of joints in the human body. A fibrous joint is where the bones are bound by a tough fibrous tissue. These are typically joints that require strength and stability over a range of movements. Fibrous joints can be further subclassified into sutures, kyphosis, and syndesmosis. Sutures. Sutures are immobile joints, synarthrosis, and are only found between the flat plate-like bones of the skull. Fun fact. There is limited movement until about 20 years of age, after which they become fixed and immobile. They are most important in birth, as at that stage the joints are not fused, allowing the termination of the skull as it passes through the birth canal. Fibrous joints. Kyphosis are also immovable joints. They are found where the teeth articulate with their sockets in the maxilla, upper teeth, or the mandible, which is the lower teeth. Syndesmosis are slightly movable joints. Amphiarthrosis. They are composed of bones held together by an interosseous membrane, the middle radioulnar joint, and middle tibiofibular joints are examples of a syndesmosis joint. In a cartilaginous joint, the bones are united by a fibrocartilage or hyaline cartilage. There are two main types: synchondrosis, primary cartilaginous, and symphysis, secondary cartilaginous. Synchondrosis. In a synchondrosis, the bones are connected by hyaline cartilage. These joints are immovable. And an example of a synchondrosis is a joint between the diaphysis and epiphysis of a growing long bone. Cartilaginous joints. Symphysis. Symphysial joints are where the bones are united by a layer of fibrocartilage. They are slightly movable. Example: adjacent vertebral bodies are connected by fibrocartilage. Synovial joints. A synovial joint is defined by the presence of a fluid-filled joint cavity contained with a fibrous capsule. They are freely movable and are the most common type of joint found in the body. Synovial joints can be subclassified into several different types depending on the shape of their articular surfaces and the movements permitted.